Targeted therapy. Targeted therapy is a type of cancer treatment that uses drugs or other substances to identify and attack specific cancer cells without harming normal, healthy cells. The goal of targeted therapy is to block the growth and spread of cancer by interfering with specific molecules that are involved in the growth and spread of cancer cells. This is different from traditional chemotherapy, which targets all rapidly dividing cells, including healthy cells. There are several different types of targeted therapy, including 1. Monoclonal antibodies. These drugs are designed to recognize and attach to specific proteins on the surface of cancer cells. 1. Once attached, they can signal the immune system to destroy the cancer cells or block their ability to grow and divide. 2. Small molecule inhibitors. These drugs are designed to target specific molecules inside cancer cells that are involved in the growth and spread of the cancer. 2. They work by blocking the activity of these molecules or interfering with their ability to interact with other molecules. 3. Immune checkpoint inhibitors. These drugs are designed to block proteins on the surface of immune cells that prevent them from attacking cancer cells. 3. By blocking these proteins, immune cells can recognize and attack cancer cells more effectively. 4. CAR T-cell therapy. This is a type of immunotherapy that involves collecting and genetically modifying a patient's own T-cells to recognize and attack cancer cells. 4. The modified T-cells are then infused back into the patient's body to attack the cancer. Here are some key aspects of targeted therapy in cancer treatment. 1. Molecular targets. Targeted therapy drugs are designed to bind to specific molecules, such as proteins, enzymes, or receptors, that are involved in cancer cell growth and survival. 1. For example, some targeted therapies block the activity of the epidermal growth factor receptor, EGFR, which is often overactive in cancer cells and promotes their growth. 1. Others target the vascular endothelial growth factor, VEGF, which helps tumors grow new blood vessels to feed themselves. 2. Biomarker testing. To determine if a patient is a candidate for targeted therapy, doctors often perform biomarker testing. 2. This involves analyzing a patient's tumor tissue or blood sample to look for specific genetic mutations or other molecular features that indicate the presence of a target for a particular drug. 2. For example, patients with non-small cell lung cancer, NSCLC, may be tested for mutations in the EGFR gene to see if they would benefit from an EGFR inhibitor. 3. Combination therapy. Targeted therapy is often used in combination with other cancer treatments, such as chemotherapy or radiation therapy. 3. This can increase the effectiveness of treatment by targeting cancer cells through multiple pathways. 3. For example, a patient with HER2-positive breast cancer may receive a combination of trastuzumab, a targeted therapy that binds to HER2, and chemotherapy to attack the cancer cells from multiple angles. 4. Side effects. While targeted therapy can be less toxic than traditional chemotherapy, it can still cause side effects. 4. The side effects depend on the specific drug and the molecular target it binds to. 5. For example, some EGFR inhibitors can cause skin rashes and diarrhea, while some VEGF inhibitors can cause high blood pressure and proteinuria, protein in the urine. 5. Emerging therapies. Researchers are constantly developing new targeted therapies and expanding the use of existing ones to more cancer types. 5. For example, immunotherapy is a type of targeted therapy that boosts the immune system's ability to recognize and attack cancer cells. 5. There are also targeted therapies in development that aim to block specific molecular pathways involved in cancer growth and survival, such as the PI3K, ACT, mTOR pathway. Targeted therapy always successful or not? Targeted therapy is not always successful. While targeted therapy has shown significant success in treating certain types of cancer and other diseases, it is not a panacea and may not work for everyone. There are several factors that can affect the success of targeted therapy, including the specific genetic mutations or other biomarkers being targeted, the stage and location of the disease, and the individual patient's response to the treatment. In some cases, targeted therapy may only slow the progression of the disease rather than curing it completely. Additionally, some cancers and diseases may develop resistance to targeted therapy over time, requiring alternative treatments to be pursued. It's important to note that while targeted therapy may not be successful in every case, it can still be a valuable treatment option for many patients and has significantly improved outcomes for certain types of cancer and other diseases. Side effects of targeted therapy. Like any other medical treatment, targeted therapy can cause side effects, which can vary depending on the specific type of targeted therapy, the dose, and the individual patient's response to treatment. Some common side effects of targeted therapy include skin problems. Many targeted therapies can cause skin problems such as rash, dryness, and sensitivity to sunlight. Gastrointestinal problems. Some targeted therapies can cause nausea, vomiting, diarrhea, and other digestive issues. Fatigue. Targeted therapy can cause fatigue, weakness, and a general feeling of tiredness. Increased risk of infection. Targeted therapy can suppress the immune system, which can increase the risk of infection. Blood clotting problems. Some targeted therapies can increase the risk of blood clots, which can lead to serious complications. Cardiovascular problems. Certain targeted therapies can cause heart problems, such as high blood pressure, heart failure, or arrhythmias. It's important to note that not everyone who receives targeted therapy will experience these side effects, and some people may experience different side effects. Patients should discuss potential side effects with their healthcare provider and report any new symptoms or changes in their condition promptly. In summary, targeted therapy in cancer treatment involves using drugs or other substances to attack specific molecules or genetic mutations that are unique to cancer cells. It can be effective and have fewer side effects than traditional chemotherapy, and is often used in combination with other cancer treatments. However, it can still cause side effects, and biomarker testing is often needed to determine if a patient is a candidate for targeted therapy. By doing so, it can be more effective and have fewer side effects than traditional chemotherapy.